now appearing shows the cumulative number of cases, and we are now at 698 cases. I believe, Minister Tufton, we have had 2 new cases today, so we are now at 698. The dotted black line displays the number of cases without the workplace cluster, and we always put that there to just remind us just what one incident could do, that if there is any departure from the protocols, how it could have an impact on our numbers. Unfortunately, since our first case, we have had 10 deaths as depicted by the red line. The green line that you are now seeing shows that we have had 553 persons who have recovered from COVID-19. The final line in this graph, which is the blue line, shows the number of active cases. That is the number of persons who still have the virus. Our recovery rate is now somewhere in the region of 79.2%. The most important number that we now need to focus on is the number of persons hospitalized. As of yesterday, we have had 13 persons hospitalized, including suspected positive cases of COVID-19. We also have 13 persons isolated in government facilities and 100 isolated at home, 42 quarantined in government facilities, and 3,581 quarantined at home. Now, the second graph, which should be appearing on your screen in a couple seconds, would show the effect of controlled re-entry. That is the new numbers that we have brought in. The dashed purple line, which should be coming up anytime now, purple line, which should be coming up anytime now, shows the number of cases excluding the positive cases from persons arriving under the controlled re-entry program. So in other words, if we didn't have the controlled re-entry program starting from somewhere around the 1st of June, that would be our numbers, 535 thereabout. But of course, that is not an option for us. We must bring home our Jamaicans. That is just for illustrative purposes to see that if there were no re-entry, that our curve would be essentially flat, which would mean that we have essentially brought under control the spread of the virus locally. With the controlled re-entry program, you could see that we are now at 698 cases. In effect, we have added approximately 162 positives to our numbers as imported cases. Now, since June 1, we have added 82 new cases, which amounts to a positive rate of about 0.7%. So since June 1, when we established the accelerated controlled re-entry and then the controlled entry program on the 15th of June, 82 persons have been tested positive from the numbers that have come in, and that translates to approximately 0.7% in terms of a positive rate, and that is well below what we had projected. We had projected that we would have probably a 2.5% positive rate, and we set our trigger from that, from June 1, and the end of June, based upon that 2.5% projected positive, we would have had somewhere in the region of about 851 cases. Thankfully, that did not materialize. Our positive rate is 0.7, and we are at 698. So I think we could declare today that the program of controlled re-entry, which was between the 1st of June to the 15th of June, and then the program of controlled entry from the 15th of June to the 30th of June, I think generally you could say that those two programs were successful. We managed to bring in our Jamaicans safely, and we managed to bring in visitors and residents safely between the month of June. This is not to say that we are out of the woods. This is not to say that we can now become complacent. And as I observe, I am seeing where there is a sense of complacency setting in, where people somehow are of the view that the pandemic is over. That is not the case, and I want to take this opportunity to again appeal to our Jamaicans to remember, observe the measures, wear your mask, do your hand sanitizing, do your social distancing, and just be very careful about your personal health and your own interactions. The pandemic is not over, as you would see in countries that are close to us, that their numbers are rising significantly. And it is, you know, aside from the good management that we have given to the pandemic, but a lot has to do with your own personal responsibility and your faithfulness and consistency in observing the measures. And that has ensured that we have kept our numbers here low. But that comes at a very high cost. And now we are at the point where we will have to reconfigure and rethink how we continue to apply our public health measures in terms of managing the pandemic. So let me turn now to some of the measures that are in place and how they are being reconfigured. So most of the measures that are in place would have come to an end on the 30th of June. So we have to give notice of what the new measures are to get people prepared. So as we seek to look at the new measures that will obtain as of July 1, 2020, we emphasize that we will continue to take a risk-based management approach, which is, as I've said, is evidence-based, measured, and proportionate. The objective continues to be the need to reduce the exposure risk of the population to COVID-19 while increasing the capacity of the public health system to respond to cases within the population so as to reduce the risk of spread of the virus. Now, curfews. The day to next day, night to early morning curfews will continue in place, starting now at 11 p.m. on the night of June 30th, 2020 to 5 a.m. July 1, 2020, day to day until 5 a.m. on the morning of July 31st, 2020. So essentially what that means is that we have increased your movement hours, reduced the curfew hours by 1 hour. So instead of 10 p.m., the curfew starts at 11 p.m., and this will be for the entire month of July. Licensed public passenger transport, whether or not they're state or privately operated, are allowed 1 hour after the end of curfew. So as of Wednesday night, July 1, that will now be between 11 p.m. and 12 midnight until the 31st of July 2020, and they will be allowed to travel home from their last passenger drop-off, and they would have 1 hour before the beginning of curfews. That would be between 4 a.m. and 5 a.m. until July 31st, 2020, to travel to their first passenger pickup. Of course, no passenger must be transported in their vehicles during the additional 1 hour periods allowed for transport operators to travel to and from their homes. In terms of gatherings, gatherings are not to exceed 20 persons, and this will apply up to July 14th, 2020. And whenever we do the measures in 2-week stretches, that is to give us time to observe as to whether or not we can go for the long term with these measures. So we are increasing from 10 to 20. And gatherings, I think, have been the gathering rule has been a very important rule in the management of the pandemic. And we are at the stage now where we believe that we can increase the gathering numbers. However, we must at this point emphasize that for any gathering at all, you must practice your social distancing. That is the minimum 6 feet apart, and always wear your masks. Do your hand sanitizing. Do your own surveillance. Look for people who are coughing and sneezing and stay away from them. And if you are ill, stay home. In terms of the operating hours of markets and vending in public arcades and public transportation centers, these will now be as follows. Mondays to Saturdays, 6 a.m. to 7 p.m. You will recall that they were Mondays to Saturdays, 6 a.m. to 6 p.m. We have now added an additional hour. Markets will remain closed on Sundays. This is usually the period of time that the various municipal authorities do their sanitization program and cleanup. Now, the creative sector and entertainment, we have heard the appeals from the entertainment industry. Indeed, I listened to them very carefully. I have seen some proposals come across my desk. I've listened to the interviews on radio. And I do know a few people in entertainment who constantly send me messages and who don't miss a beat to appeal. And of course, you will know that my constituency is the heartbeat of Kingston. Minister Bartlett will say Jamaica is the heartbeat of the world. We have a very vibrant hip strip in the constituency, so I get the appeals on a regular basis. Yes, we will be at our next COVID management meeting, which would be Friday of this week. We will now give some focus to looking at the protocols and some of the proposals and suggestions. This is not an invitation to inundate. We wouldn't be able to examine all the proposals, but we will be looking now seriously at the industry to see how we can see to its reopening in a safe way for everyone. It will take some time. I'm not here telling you that next week or the week after, but at least we will start the process. And just as all we have done with the bars and the churches and other areas that we have opened up, we follow the gradual approach, and we also ensure that it is evidence-based and situationally appropriate. So I want to thank the entertainment community for their patience. Yes, I have seen some of the flyers saying no entertainment. Well, I won't say what the other part of the slogan is, but Minister Mackenzie, I believe you showed me the flyer where it said no entertainment, no voice. Yes, well, we pay close attention to the entertainment industry and our friends in the entertainment industry. We want to get you back up and running, but we want to do it safely. So we'll start the examination of that on Friday, I'm almost certain that the Economic Recovery Task Force would have spent some time looking at some of the protocols as well. So significant work would have been done in some areas of entertainment. So we'll put all of that together, and we should now be in a position within the month of July to see how best we can reopen some of the entertainment venues. In terms of restaurants and places of amusement, Minister Mackenzie will give you a briefing today, but I expect that in Parliament on Wednesday you will give the full details as to how that will work. Now, I must say that, Minister Mackenzie has done an exceptional job in managing the bars and other areas of reopening, including the beaches. But recently I saw some pictures of the beaches in Jamaica. I thought they were the beaches in Miami, and I had to look closer to realize that it was a beach in Jamaica. I know that the psychology of the lockdown has created a huge depression even for some, that some people are just so now fatigued and frustrated, and going to the beach, going to the rivers, that's a great outlet. And we understand that, we acknowledge that. We want you to be able to have some relief, some distraction, but we also want you to be safe. And there are notions going around that you can't get ill or contract the virus when you are in the sea water or you're at the beach. But you can contract it if you are buying from a vendor, if you're all close together, if you're undertaking sport activities where you're all close together. So, we make the appeal, and Minister Mackenzie, I'm certain, will make the appeal again, that if you are going to the beach and you see a crowd there, don't go. If you're going to the beach as a household unit, stay together. People who operate the beaches, we have asked that they don't put out any chairs or stalls for selling. The report from Minister Mackenzie is that that is not being observed. So we will have to take some action in this regard, and Minister Mackenzie will say a little bit more about that. In terms of zoos and parks, the opening hours are now 10 a.m. to 4 p.m. for zoos, and for parks, including theme parks, this would be 6 a.m. to 8 p.m. Note that water parks and attractions remain closed. Now, daycare and nurseries, this is a big issue. We spent some time last week discussing them. The Ministry of Health, the Ministry of Local Government, the Ministry of Education, and we are expecting that by our next press conference, we should be able to have some protocols as to how we would treat with the reopening of daycare nurseries. Very important as people go back to work. Measures related to the wearing of masks, infirmaries, the correctional officers, and so on will be extended to July 31st, 2020. And now I want to give you an update on the controlled re-entry of Jamaicans. The latest number from the JamCOVID site and the Visit Jamaica site, this would be, we have processed now approximately 31,000 applications for Jamaicans and visitors who want to come to Jamaica. 23,000 are residents, meaning Jamaicans who are coming back home, and non-Jamaicans who live in Jamaica. And 8,000 are non-residents, visitors, tourists. Approximately 14,600 persons have arrived in Jamaica since we have put in the controlled re-entry program. 9,300 are residents, meaning Jamaicans who live here and non-Jamaicans who reside here. and 5,300 are non-residents, meaning tourists, Jamaicans who are visiting, and non-Jamaicans who are Jamaicans who come here to visit. Now, an additional 15,000 persons have been approved to travel. 12,400 are residents, meaning Jamaicans and non-Jamaicans who reside here, and 2,600 are non-residents. So in that number would be some tourists who would be coming, or most of that number would be tourists. Now, during June, we had an average of 5 flights and about 410 passengers arriving per day. For July, our projections are, well, these are not projections. These are what we expect by virtue of the flight schedules that we are now seeing. We're going to be expecting an average of 22 flights and 1,680 passengers per day. Now, I want you to understand the call on resources that this will mean. You would also recognize that there are many Jamaicans who have been overseas now since we closed the borders to incoming passengers, and that would be somewhere in late March. It is unthinkable that we should do anything to prevent their return home. And what you're seeing here is the buildup of Jamaicans who have wanted to come home, and now they are exercising their right so to do through the protocols that we have established. So we still have to make sure that they can enter Jamaica safely and that the population here is protected. But you can imagine the resource constraints that we would face to keep the same levels of controlled re-entry that we have kept through the month of June. We did that very high-level control protocol so that we could establish, using very stringent criteria, what is the risk that the population faces from the re-entry program. And I believe I haven't seen yet the expenditure. But Minister Tufton, when you get a chance, and amongst all the other things you have to do, I would love to see what that program has cost the country. We now know, in keeping with our evidence-based management, what the risk is. We budgeted 2.5% positive rate. We ended up at somewhere at about 0.7. It doesn't mean that we drop all guard. It doesn't mean that we don't need to have protocols in place. What it means, however, is that we can reconfigure the limited resources that we have, because in order for us to have done this, that is to put in place this very robust control entry protocol, is that we have had to move resources from the interior, meaning we have had to move resources from the clinics, from the health centers, from the hospitals, from head office, from the regional offices, and they were basically stationed at the airports. One airport had about 200. If you took into consideration the police and military personnel and everybody who else was there. And both airports were operating at that kind of manpower and capacity. That is not something that we can do forever. And the longer we do it, the greater the fatigue. And at this point, let me thank our health workers. They have done a tremendous job. They have made us proud. They have done well. And, you know, Jamaica is the talk of the town about our protocols. But these protocols can be stressed and stretched to the point where they defeat the purpose. So we have deliberated now for the last 2 weeks, and which is one of the reasons why we were late in coming to the press conference, as to how we will treat with the re-entry. The CMO is here, and if I run into any difficulties in explaining it, she will come and stand right beside me along with the Minister of Health, who will both help to explain the sound public health science that guides our decision making. So as of July 1, 2020, we will still require testing for controlled entry. However, since the commencement of controlled re-entry on June 1, we now have the benefit of testing for over a month, and we now know the positive rate, 0.7%. Therefore, we can now reconfigure the protocols surrounding controlled entry into Jamaica at our airports. This will allow us to more efficiently utilize our limited resources for testing and surveillance, both for ports and intra-island at our health centers and other health facilities. So all arriving passengers would still be subject to a health screening and risk assessment on arrival at the port of entry. Visitors to Jamaica from areas declared as high risk at this time by the Ministry of Health and Wellness, so areas such as Florida, New York, Arizona, and Texas, those are considered now high risk. So persons registering to visit Jamaica on the Visit Jamaica website, coming from these areas, as of July 1, will be required to upload a valid PCR test, which must be no more than 7 days old from the expected date of their arrival. Now, approval for travel to Jamaica on the Visit Jamaica website will be subject to the upload of this valid PCR test. As of July 10, persons visiting Jamaica, that is a non-resident visiting Jamaica from the declared high-risk areas, will be required to present their PCR test. So let me just walk that through a little bit. So yes, we are requiring pre-testing. But the requirement for pre-testing will, as we have said, be risk-based. We're looking at the areas where the numbers in the originating destination, or rather the area they're originating from, where those numbers are high. And those areas, we would, as of July 1, require persons who are visiting Jamaica. That is, they have to go on the Visit Jamaica website. That site will now require the visitor to upload a valid PCR test. That test will be used to determine approval for entry into Jamaica. And we have put it in that language, but obviously, if you upload a test that is negative, that doesn't mean you will be automatically approved. We still look at other things, but it is highly likely you'll be approved. But certainly, if you upload a test that is positive, then we would not approve you. And it is very important that that be said. If you know that you are positive, we urge you, reconsider your travel. Reconsider going out into the public, taking, transportation and going on the aircraft. If you know you have been exposed and you are in high-risk areas, then don't seek to travel at this time. So, yes, we will require pre-testing, and the condition would be that when you arrive and you present your pre-test, it should be no older than 7 days from the time you have tested. And we will be requiring persons to present their test from the 10th of July. So that's enough time for people who are seeking to travel to make arrangements to have their test. Right. Now, Jamaican residents and visitors staying outside of the resilient corridor. So these are people who are coming into Jamaica they are Jamaicans or non-Jamaicans, but who probably live here or who have family here, and they are staying outside of the corridor. They will be they will be checked based upon the risk assessment of their health and the usual health and risk-based assessment that we use for everyone. And they will be required to make an appointment at one of our testing locations to do a PCR test. Let me explain that a little bit. So non-Jamaicans and Jamaicans who are coming home, they are not going to resorts, they're coming to be amongst the general population. At the airport, they will be screened. Now, clearly, if we screen them and they are showing symptoms, they would have to be isolated. So they would then come under the protocols of the Ministry of Health. And that would include testing as well. If the physical observation does not reveal anything, but the assessment of where they're coming from, the group to which they are a member, reveals that they are high risk, then they will be required to register, make an appointment for their PCR test. They will go home, but they are under quarantine orders. So the arrangement is, we send you home, and you're under quarantine orders. You then do your test. That is, you go to your nearest health facility. You go back home under quarantine orders. You await your test results. And depending on your assessment, if your result is negative, again, it's still an assessment, you could be under quarantine or you could be under stay at home. If your result is positive, then you could be asked to isolate at home, or you may be taken into a state facility because where your conditions at your home may not be suitable for isolation or quarantine. Now, it is important that Jamaicans understand that we are not abandoning testing. Testing will be done. But in order to ensure that we can test everyone coming in, this is the best way to facilitate the testing. We certainly just could not test 1,500 people coming in on a daily basis at the airport. That is not possible based upon the resources that we have. So it is best that they go home, quarantine, and then test. You know, if you just stop for a while and consider it, it's the same thing. We swab them at the airport, but they travel home and they await their test under quarantine. So in any event, you know, the risk of sending them home without testing is not much greater than the risk of testing at the airport. But to further mitigate the risk, the redistribution of the resources from the airport back into the community, that's very important. When we move the people out of the community, we are not able to conduct the surveillance. So we have to bring back the professionals into the community, and they will be supported now by the 1,000 community health aides that Minister Tufton is now mobilizing. And they would definitely need to have the professionals alongside them to train them to do the community surveillance. So that is the public health advice, and that is what will prevail come the 1st of July. I think based upon the evidence we have of the risk, based upon very detailed examination of the options we have, based upon our budget and the resources that we have, based upon the risk of fatigue and breakdown of the Ministry of Health staff, which they have been pushing so hard during this pandemic, I believe that this is the best option. Of course, I am well aware that we will have many critics and many persons who will have other ideas. We are always willing to hear what else could work. We don't claim to have a patent on knowledge, so we always want to hear if there are other methods that can be used, but I wish to assure the nation that this is something that we deliberated on long and hard, even up to today, even up to the last 30 minutes. Minister Tufton and Minister Bartlett and Minister Mackenzie, the entire cabinet was deliberating on this matter. But I believe we have come to what is the best solution so far. Of course, tourists who are coming into the island, again, they have to be tested before they can come into the island. They will go through the screening. They will go to their resort or hotel or wherever they are staying within the COVID resilient corridor, because that is still operational. And of course, if during the screening they are showing symptoms, they will be isolated, they will be tested. The stay in zone orders for the COVID resilient area is a strict order which we intend to enforce, but so far we haven't seen any need for that because the level of compliance has been fairly high. The hotel operators understand that it is important to ensure that the visiting population is kept separate as much as possible from the on-island population. We will have to, of course, do much more surveillance and testing of the hotel workers to make sure, because they would be the conduit from hotels to communities. And the Ministry of Health has given me the assurance that that surveillance and testing will be ramped up in the days coming. So, ladies and gentlemen, I could, if there's no other matter, let me just check my notes here. Yes, I believe we have covered. Yes, we have covered everything except the business traveler. And the business traveler, and by definition, this is someone who is coming for less than 14 days, the business traveler will be tested at the airport. And the original protocols that applied will continue to be applied. So the business traveler, we require that they be tested at the airport. They could go to their hotel, they quarantine at their hotel or place where they will be staying. And upon the receipt of their result, if their result is negative, then they are allowed to conduct their business. And if their result is positive, then they fall under the standard health protocol of isolation and treatment. So, ladies and gentlemen, again, apologize for the late start, and thank you for listening and watching. May I invite Minister Mackenzie to, if you want to give any update on the beaches. And then I'll ask Minister Bartlett to just give a brief overview as to what has happened with tourism, and then the Minister of Health to give his update.
Thank you. Thank you, Prime Minister. Just to say, last week when I gave the update in Parliament on the performance of the beaches, over this weekend, Prime Minister and colleagues, we did another underground assessment, and we have found that there is about 91% non-compliance of all the protocols of the beaches that we surveyed over the weekend. As you mentioned, I'll be making a statement in Parliament on Wednesday. And in that statement to Parliament, I'll be outlining certain steps that we are going to be putting in place to ensure that we get the kind of compliance that is required, among other things in making announcements as it relates to other areas of responsibility. But I just want to make the point to the wider public and to emphasize the point earlier made by the Prime Minister, that there has to be a certain level of responsibility that is brought to the table by Jamaicans. We understand the importance of going to the beach and to the rivers and to exercise and to have some level of freedom. But we have to do this in a controlled fashion. And what we are seeing is a level of indiscipline that has creeped into the use of these facilities. And I want to commend those operators who have made the efforts to ensure that a lot of the protocols that have been outlined have been put in place. So again, I want to use tonight to make a final appeal so that on Wednesday, when I address the matter fulsome in the Parliament, I will be in a better mood, Prime Minister, to advise of the steps that will be taken.
Thank you, Prime Minister, colleagues, distinguished partners, media. The tourism partners all have, I think, responded well to the challenge of the phase opening. And I'm very pleased to advise that Jamaica's approach has been noticed by the world. And the comments that we've been getting from across the globe have been very flattering, and indeed it is indicating that when all our partners come together and when we are committed to a task and when we apply our collective will and our collective intelligence, we can make a difference. Are we perfect? No. Are there areas that we have to deal with? Yes. And these areas we are going to deal with, the team that we have established, Prime Minister, continues to work. Up to this morning, the COVID recovery team met, including the opposition spokesman on tourism, Dr. McNeil, who is a member of the team. And he's fully au fait with all that we have been doing and saying. And he makes his points, and we take them into account, and we deal with them, and we make sure that there is a general understanding as to the way forward in managing this phased opening of tourism. Prime Minister indicated just a little over 5,000 visitors and Jamaican nationals who are living overseas came to our shores during this first 2 weeks. We've brought back somewhere in the region of 15,000 workers, and we look forward to going to step 2, as indicated by the PM, and the JTB will be working with our partners so that they understand the way in which we are managing this whole process, and most important, the algorithms that are guiding the management that are clear and that people can follow and understand why we do what we do. So I want to say thanks again to Ministry of Health and the teams who have worked so hard with us. The protocols are being observed, and we want to strengthen now. And just, Prime Minister, I want to announce that we've today, this morning, put together a new COVID Resilience Corridor Management Team that will be led by John Biles and Andrew Spencer. And that team will be responsible for tightening up the arrangements within the corridor so that we could not only fulfill the obligations that our protocols are requiring, but also to ensure that the order that establishes the corridor can be understood by everybody and complied with by all. Thank you, Prime Minister.
Minister Tufton.
Thank you very much, Prime Minister, colleagues, ladies and gentlemen. First of all, I want to just take the opportunity to thank the Honourable Prime Minister and the Cabinet for their leadership and support over these number of months as we have maneuvered, if you will, this COVID threat that has affected our country in a significant way. I want to also use the opportunity to just recognize and really commend the public health team, led of course by the Permanent Secretary and the Chief Medical Officer, but involving thousands of public health workers, over 17,000 in the public health system, and administrative staff, but in particular the frontline workers, the contact tracers, the public health nurse, inspectors, community health aides, all of whom have been directly involved in the front line and certainly have put their lives at risk for the benefit of the country and for the overall cause. You know, I think we need to remind ourselves every day as to the efforts that they make, and so I want to reiterate that. But in particular today, I reiterate that because I think we're at a crossroads in terms of the phases of response to this COVID risk. And the Prime Minister articulated it well when he summarized the need for 100% testing over the past month, that's the month of June, and the data that was collected and the use of that data to assess the approach, to expand and to learn from the approach, to go through a learning curve, so that we could make the necessary adjustment with management of that risk. Now, it's a risk that evolves, and so while certain variables may remain fairly constant, there are other variables that are changing, and some of those variables are not totally in our control. So even though we had a 0.7% positive rate for the numbers that came in, I think about 14,000 or so over that period. The truth is, when you look external to Jamaica, despite the efforts of our team members, the reality is that primary source markets, whether for residents or non-residents coming in, that risk profile is also changing. But it is changing in a way that requires us to assess that risk, not just as one destination, meaning North America, but looking at states within North America and applying a particular risk profile depending on the different states. And that's what we have done in assessing where that risk is greatest and why testing as part of the overall screening process may have to continue. And we juxtapose that against the capacity of the local team to continue in a sustainable way the type of 100% testing. I mean, everybody will be screened, and frankly speaking, we have always screened at our ports of entry. And I think Jamaicans need to recognize that. Sometimes you don't notice it, but temperature checks are done, the nurses are always there, and they will pull you from the line if they suspect, question you, and of course subject you to further interrogation if necessary, depending on what they're looking for. So that will continue for everybody. But as it relates to testing, as the Prime Minister said earlier, we think that we're at a point, and given the capacities of our resources, the public health team and the infrastructure, where we can now distinguish the risk from one state to the next, and by extension, individuals depending on where they're coming from, and then apply an approach that may not always involve testing. So with the tourists or the non-residents, as the Prime Minister said, effectively the 10th, is it the 10th or the 7th? The 10th. Those persons who are going to be uploading information on the JamCovid Visit Jamaica site would need to do a PCR test within a 7-day period of travel. And that for us represents one form of screening. And it's essentially doing what we would have done here with everybody in the month of June. And we believe that it's important to be done, at least for the time being. And what it does, it frees up some of the resources that we have here to do the type of community-based surveillance as we had to do over the past week in Norwood, St. James, or in West Kingston. It's the same persons who have to do some of that work. So for us, that's important. And at the same time, I want to just reiterate that not all non-residents will come from a country that is high risk. And the risk profile, we use the determination based on rates of infection, but also we're guided by the WHO, the World Health Organization, and PAHO to conclude on those countries that are high risk or states that are high risk. Where that risk is deemed not to be as great, then testing would not be necessary in those cases based on the designation of the risk. And the health authorities will make that determination. And I just want to say to those who may be concerned that we, in public health, as is the case with the government, will not take any decision that is going to jeopardize or unnecessarily put the country at risk. I think we have done well so far, and hopefully that credibility that we have is intact, and we will maintain and be as transparent as possible with that approach. Similarly with Jamaicans, it is about the high-risk groups. They will be sent home, having been screened initially, would be assigned to go and do their testing at a location that will be designated. But as I understand it, based on the decision we have taken, the testing is a function of the risk, even though the 2-week period stay at home would be maintained. And what we would require of them, and I'm closing now, is that all Jamaicans and non-Jamaicans who come into the country, if they have symptoms, and this is very important because over the past week, we have had cases with persons with symptoms who have not reported those symptoms. It is absolutely necessary that if you have the sneezing, the cough, the cold, anything that is linked to COVID, and we have to see it as our duty to remind persons of those symptoms, you must check in with your 8881 Love number for guidance or with your health center and continue to protect yourself with the protocols that we have announced, the masks, the sanitizing, the quarantining, the social distancing or physical distancing. That is very, very, very important. I close, Prime Minister, with your permission, by just giving an update on Norwood and West Kingston. So we did 2 days, Thursday and Friday, June 25th to 26th. In the case of West Kingston, we had a team of nearly 100 or so public health workers in that community, the particular community. We visited 264 homes. We interviewed 721 citizens, and we collected 137 samples. We had 4 positive cases in the first instance, and we discovered 1 additional positive case. And that represented for us a much better understanding of what is happening there. And we did not find a need for quarantining the community. And finally, in terms of Norwood, we did 2 days, that's Friday and Saturday, June 26 and 27. We had 40 staff members there. We did 63 home visits, interviewed 279 persons, collected 165 samples, and we, through the contact tracing, which is contacts of the original case, we discovered an additional 8 cases. At this point, we did not see the need for quarantining the community. But it just goes to show the effort that is required and why we need the resources in the communities where we believe the risk could be great if we allow a community spread to take place. Thank you very much.
Thank you, Ministers, for your presentation. I believe we could take a few questions.
Thank you so much, Mr. Prime Minister. Ahead of us starting this evening, we did have a test of all systems with members of the media, and we have outlined the ground rules concerning exactly what would happen this evening. And so, sir, there are 21 persons on our Zoom platform. And let me start off then with Ms. Dion Jackson Miller from Radio Jamaica. Mrs. Miller.
Thank you so much, Naomi. Appreciate it. Couple of questions. One, can I ask for clarification on the July 1, July 10 dates in relation to testing? Not quite clear what is happening on what dates, what date the requirement for the testing becomes effective. That's one. Two, given what we're seeing in the United States, and yes, some states are seeing worse surges than others, but why isn't there an across-the-board requirement for persons coming from the United States to be pre-tested? And final question in relation to what we're seeing coming out of reports about additional complications being suffered from persons who have supposedly recovered from COVID-19, that the virus is now being seen by researchers as perhaps attacking other systems such as the cardiovascular system, leading to stroke and heart attack in people who were thought to have recovered. Is the Ministry of Health following up on our patients who have recovered, since they and their families may not necessarily make the connection in terms of what we're seeing reported?
Thank you, Dion. Excellent questions. In terms of the dates, so the 1st of July would mark the beginning of the pre-testing requirement for those coming from or originating from areas which the Ministry of Health will define based upon our own surveillance and intelligence as high risk. I believe I named a few areas. It would be Florida, Texas, New York, and Arizona. Those are what we have declared so far. So those persons who are visiting Jamaica, so they are coming in for a short period of time and are likely to be going into hotels or other such places, they would be required to get a pre-test done in the area that they're coming from, a test done rather, before they come to Jamaica. They would be required to upload that test on the Visit Jamaica website, and the test should not be more than 7 days old at the time they arrive in Jamaica. And we will start requiring that test in 10 days. So the passengers who will be required to present that test would be the passengers that are arriving in Jamaica on the 10th of July. So on the 10th of July, we will start asking for the test. But remember now, they would start applying on the 1st and uploading from that period of time. And therefore, their approval coming into Jamaica through the Visit Jamaica website will be dependent on whether or not they have actually uploaded that pre-test. So between the 1st and the 10th, you could consider that to be a notice period. The other question, I think the CMO would be the best person. That's a clinical question.
Thank you, Prime Minister. Good evening, everyone. Thanks for your question. In terms of the cases that have been reported, we have noted over time that there have been case reports of persons that are developing disorders that are related to other systems outside of the respiratory system and have had poor outcomes in some instances. So we have noted this. What we have done is that from the Ministry of Health perspective, we have been following up our cases that have been discharged. Our discharge protocol involves a 7-day test and interview, and then a 14-day test and interview. So we will be looking how we extend that period over time to see if we require to have 3 months reviews, 6 months reviews for these persons. In addition to that, all persons that come into hospitals that have these kind of illnesses, we are asking for these persons to be tested. Even if it is not thought to be COVID-related, but any persons that are going into our ICUs, any persons that are critically ill, persons with depressed consciousness, strokes, serious illnesses, we are requiring a test to see if there are any issues related to COVID. As we develop the capacity to do antibody testing at the National Public Health Lab, we would also be accompanying that PCR test with an antibody test as well. Thanks.
So, Dion, just for greater clarity, so from the first, the Visit Jamaica website will require you to upload your PCR certificate test result. That will be the basis on which approval for travel will be given if you are coming from the areas that are declared by the Ministry of Health as high-risk areas. But you have a 10-day period in which to go and get your test. So when you come into Jamaica on the 10th, that is when now we would start to require you to present the physical certificate to us. So the 10th and afterwards. Thank you, Dion.
Thank you so much, sir. Let's then go over to Ms. Brittany Clark from Nationwide News Network. Brittany?
Hello, good evening, everyone. So 2 quick questions. So the first one, there's a suggestion on the table for the government to charge a COVID tax for visitors and returning residents to offset the cost of testing and the provision of PPEs. I just wanted a response from Prime Minister Holness on that. And for the CMO, there are also suggestions that visitors and returning residents have gone through the process of testing and are yet to receive their results even after a 7 to 14-day period. So can the ministry give an update as to how many cases from the controlled re-entry are actually backlogged and what additional resources are being employed to clear this up? Thank you.
I don't usually comment on anything to do with taxes because that's not, at this time, that's not what we would want to even signal or communicate. But I will say to you that the protocols have been a call on the Treasury in a significant way, and we will have to put in place measures to recover some of that. So there are things being considered. We wouldn't call them taxes, but certainly there are things being considered. At some point in time, the traveler will have to bear some part of the cost, but we're not there yet. We're not at that point yet. Sable?
Hi, good evening, Brittany. So at this time, we are having some challenges in terms of our turnaround time. Okay, this is in one due to the large volume of tests that we do have to process. In addition to that, we are experiencing some challenges in terms of supplies for one of our machines, which would have been where we would have had the largest numbers of tests being done. Now, to mitigate this, what we have been doing is that we have recruited other machines to be testing. So we were previously using one PCR machine at the National Influenza Center. We are now using 3 or 4 machines there. However, that system is a slower system, so the turnaround time is a little bit longer. In addition to that, we have also recruited 2 PCR machines at the National Public Health Lab that we are using to do testing. But this is the same system as the ones at the university, so it's a bit slower. But in short order, we do expect to get our supplies for our Cobus machine, which is the machine that really puts out the bulk of tests. It is important to note that there is a global demand for supplies, And so we've done a large amount of testing over the last couple of weeks, and so therefore this has put a little bit of stress on the supply chain. However, we are working to overcome this problem, and we are recruiting all the other resources to get this over.
Thank you, CMO. Sir, I see two other questions on our Zoom call. We'll go to them shortly. But from our social media persons, there are some persons who would like some clarification. Let me just say that they're thanking you for extending the gathering and the curfew orders. But they also want to know, three questions I'm going to take from them. One, can you explain really why attractions and water parks are not open, but we have rafting going on? The other one I just quickly throw out to you. If I have a relative who's died overseas and I want to return the body to Jamaica, what's the protocol there? And finally, for persons who want to leave Jamaica to go to work or do business travel for a few days and back, the protocol for that.
The water attractions, the water parks, some of these would be also considered to be attractions for tourists and the like, and those are going to be treated in the second phase of the reopening. So we will eventually get to that in a matter of weeks. But in any event, the water parks would be, defined areas, smaller areas than, let's say, a river or a beach. And so the ability for social distancing, if crowds were to descend on them, would be much harder. But as you can see with the beaches, they're all still a risk. In terms of someone wanting to return home a body of a loved one who had passed, the normal protocols that would obtain the undertaker in the United States would make contact with an undertaker here, get the necessary approval from the Ministry of Health, and the Ministry of Health will upload the protocol on their website. Yeah, but the normal protocols would. And remind me of the third question.
The third one was if someone wants to leave to go on business travel from Jamaica.
So what we have not yet factored in is that there are a number of many Jamaicans are leaving the island to take care of business overseas and return. They must go through the JamCOVID website. They must get their approval, and when they come back, they will be under the same protocols. They will be screened at the airport. They will be required to quarantine at home. They will be registered for a test. They will go and do their test. They will quarantine until their results are available, and then they will be under stay at home for the rest of the time.
So they must apply through JamCOVID even before.
The only way you're going
Jamaica.
to be allowed to re-enter is through just registering. So we know who has traveled to where, who has been exposed. And the beauty of it is, if you look at what Minister Tufton has just told us about Norwood, I had said Flanker, which was an error, Norwood, and then West Kingston, we were able to track because we know the people, we have their addresses, we interviewed them thoroughly, and that meant that we were able to quickly go in. Under the previous circumstances where we couldn't track, we were appealing to people, let us know if you came in on this flight, or let us know your address. But now we have a very good system in place. We are able to track, we are able to conduct the surveillance, we can do the contact tracing, and we can put a protection around the communities that may be impacted.
All right, thank you, sir. Let's go to our other two questions then. 18 degrees north, you're recognized for your questions. Good evening.
You could turn on your mic.
I'm sorry, we're not hearing you.
I'm sorry. Good evening. I wanted to ask about the COVID actual numbers. Mr. Prime Minister mentioned, I believe, 698 is the exact count right now. However, the Minister of Health, Tufton, he said there were 8 in Norwood, I believe, and also 1 in West Kingston. So 696 was the count yesterday. The count today, I just want to get the exact count, given the fact that we have those positives. That's one question. Second question, given the fact that there is a lag in ability to churn results, are we really ready for 22 flights per day?
Well, the first question is that the numbers that we give you, the cumulative number, incorporates all the other subcategories that we would have delineated. So, for example, when Minister Tufton pointed out that during a surveillance and sampling exercise in a community in St. James, they discovered 8 cases. Those 8 cases were already captured in the cumulative figure that is given per day. And it wouldn't be 8 cases all in one day. It depends on how the results come back. But for the exercise, it would have been 8 cases. So yes, the figure that we're giving you is a total figure. So which is why we're very careful to give out, because it adds to the complications. The headline figure is 698, and that incorporates any other figure that you would be hearing about. Just remind me of your other question was to do
regarding the
the flights and whether or not we are ready. Well,
because of the lag.
Well, put it to you this way. One of the reasons why we have to reconfigure the way in which we have been doing it is that we wanted to get 100% testing done at the airport. And I believe we did about 95%, I would say, or probably even higher than that for the last month. That gave us very good data as to what is the positive rate of persons coming in. And we can therefore plan around that to move to a different kind but equally effective control measure, which is we can't keep we don't have enough resources, for one, to be testing 22 flights coming in per day at our 2 airports. We just simply don't. So the new measure will allow for us to actually test everyone that is coming. Yeah. So with the measures that we have in place now, certainly we couldn't handle 22 flights coming in. But with the restructured, yes, we will be able to give an effective level of surveillance and protection to the local population and make it safe for those coming in.
Thank you, sir. Ms. Janet Silvera, a woman of many hats. Today she is asking questions from the Gleaner newspaper. Janet? I'm sorry, could you unmute your mic?
Unmute your mic, Janet.
Okay, fine. Thank you very much. My question is I have 2 questions. One in relation to how the cities, or the states rather, were selected. For instance, Arizona does not have as many cases as Georgia. However, Arizona is on the list of states that will be required to do the PCR test. So I'd like to find out why we are not doing the entire United States. For instance, California has 211,000, etc., etc. And all those people coming to Jamaica at some time. So I'd like to find out how the states were selected. And the other question to Prime Minister is, how concerned are you about Mayor Bell Navis's stewardship at the St. Ann Municipal Council in relation to building breaches, COVID-19 contract controversy, and the Porsche charging port?
You're a well-experienced journalist, and you would not miss that opportunity, and I understand. But let me answer the question related to the press conference first. The list that we presented is not an extensive list. That is what we have agreed upon to date for the time of the announcement. Obviously, it will not be only about absolute numbers. It will be about the rate of increase, the rate of infection, the infection control prevention measures that are practiced within the state, our assessment as to how effective they are, and clearly the volume of persons coming in. So if you look at the states that we have said, that is where the bulk of our visitors are coming from so far. Georgia is clearly a state that we will also be examining. So it will change from time to time, but that's what it is up until this point of announcement. In terms of the other matter, I have not yet received a full brief on all the issues. I met with Minister Mackenzie this afternoon. We had a brief discussion. He is to give me some more information on it. And I'm always concerned about any allegations of impropriety and corruption. My job is to brief myself properly, bring the people in who are the center of any accusation to get full knowledge. And then once I'm satisfied that there is something there that requires action, then you would know by my past track record that I do act on these matters.
Thank you so much, sir. It is 8:15. I see no other hand. There is, though, someone who had a follow-up, and given that they had one, then we'll just take that follow-up, and then, sir, you can just recap, and we'll close for the evening. Mrs. Jackson Miller, I believe, had a follow-up question. Mrs. Miller.
Thank you so much. Thank you so much, Naomi. I appreciate it. Just reminding the Prime Minister that I'd asked a more general question as to why limit the testing routine to the states he mentioned as opposed to the entire United States.
Well,
right.
Well, I just answered a part of it, being that we're looking at where the bulk of our traffic is coming from, and those states would account at this time for most of it. The challenge, however, is the availability of the PCR test. And, the debate so far has not factored in some practical considerations. So, for example, we have been testing fairly widely in Jamaica, using up pretty rapidly our stocks of tests, which is what the CMO just alluded to. But Jamaica is not the only country that is testing. Almost every country in the world is expanding their testing capabilities. But what that means is that the factories can't keep up fast enough. So if we don't plan carefully, there could be a situation where our testing requirements can't be met because we simply just don't have stock. And that's not a problem for Jamaica, it's a problem for the entire world. So there is the issue of the availability of the tests, and not all states have the same testing protocol. So it wouldn't make sense to say everyone coming in from the United States should be tested. Certainly those who are coming from the high-risk areas, yes, we would require those. Thank you. Just one last thing. We've been getting a lot of calls from persons regarding the stay-at-home orders for the 65 and older, an order that I think has worked very well in keeping our seniors safe. But, our seniors are hearty and hale and robust, and they want to get out there. So we'll extend it for 2 weeks. And then after that, we will do a review. So on the 14th of July, thereabouts, 14th or the 15th of July, we will make an amendment to the order. But especially at this time when we are bringing home our Jamaicans who are coming to look for grandma and look for uncle who they haven't seen. In fact, on the app, people actually say, almost 2,000 people say, I'm coming to look for relatives. And I think that can be the danger. I'm coming to go to a funeral, or I'm coming to go to a wedding. Remember, that is how the first spread started. Someone coming from overseas to look for family members, attend a funeral, and before you know it, we had our first outbreak in the Bull Bay community. So, ladies and gentlemen, thank you for being with us this evening, and I hope that the information has been useful.
Thank you so much, Mr. Prime Minister, and thank you to ladies and gentlemen of the media and, of course, those joining us from home and abroad on social media and, of course, in the regular media space. We urge you once again to wear your masks, practice social distance, and stay safe until next time. Good night.
Hi there, I'm Simon Preston from TVJ. Thank you very much for watching our YouTube channel. To see our latest videos and also to see live events, click here. To see our full videos on onespotmedia.com, click here. Thank you very much.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it.